Hello, I'm Rida Fakhri. Healthcare is one of the most hotly contested issues in this year's US presidential campaign. Most people in the country agree that the healthcare system is broken, but there's little agreement on how to fix it. 47 million Americans don't have health insurance, and if you don't have insurance or plenty of money, you can't get reliable care. Only the poorest of the poor, those classified as living below the poverty line, are covered by government insurance. Everyone else falls through the cracks. The ill often wait until they're so sick that they're brought to emergency rooms which must provide treatment. Different states have tried to pick up the slack, creating a patchwork of solutions. We the People traveled to the Denver Health Facility in Colorado. It has been established as the city's primary safety net for medical care. The goal is to provide even those without insurance with stable health care. But is this the best model for the rest of the nation?
My tonsils are really red, and there's actually a red dot above them. So I check my tonsils at least once a week because they're swollen, and they've been swollen for like 6 months from January to July, and there's still no resolution. I'm 23 years old, and about a year and a half ago, I graduated from Texas A&M University with a BA in biology and a minor in anthropology. I work as a caregiver for infants at a school that encourages early childhood development, basically. And I don't qualify for welfare or Medicaid or Medicare or any of those. So I'm kind of in the middle of it. As a single woman in my 20s, I have a degree, but I'm not working at a job that supplies health insurance. Tonsil is really hurting me, actually. I have a wide variety of friends. I have some that don't have insurance, and that's not going to suffice for our society. It needs to change.
Hi, Sarah. It's Jeremy Long in urgent care.
I was fine with it for 5 days.
Last 2 weeks have been really crazy.
I had all the symptoms.
I twisted my ankle.
I moved to Denver in 2002 to do my residency training in internal medicine with the thought that I would be a primary care doctor in a public setting. Exceptionally busy, the busiest day we've had in years. For 15 years, this is what I'd hoped to do. When I was in college, I realized that this was a niche that I wanted to fill, and I think it's a very challenging one.
It's just a big hassle trying to get in and trying to get cared for.
This is her second visit. She was seen for strep throat, and interestingly, her rapid test that we do and rely on here was negative.
I usually am on my parents' insurance, but it's just now that I'm 23, it's not covering me, and so I have to figure out what I'm going to do on my own, and I don't have a job that is giving me the benefits that I need, and the healthcare system isn't really helping. And I don't know, unless you're completely poor where you're getting medical aid or you have a job that's taking care of you, you're just kind of out of luck.
Denver Health is what is called a safety net institution, and it's here for people who can't pay for their health care, who are uninsured. Last year alone, 40% of all our charges were to people who couldn't pay us.
We have safety net programs, we have safety net hospitals. The problem is the distance between what people would consider first-line coverage and the safety net.
Yes. Hi.
Hi, Dr. Long, nice to meet you.
In order to qualify for a public program like Medicaid or Medicare, you either have to be disabled for a long period of time or actually be very poor. If you look historically at the cost of health insurance, around World War II, it was a benefit. So an employer could provide it. It was a way of competing with other employers.
Healthcare is something that is an issue to me as far as wanting that and desiring that. But I also know it's a very complicated process, and you can't just say you're going to do healthcare without really coming up with a plan and a design.
We have a plan. We are ready to implement it to make health care affordable and available to all Americans. There are many aspects of this proposal. One of them is to provide every American family with a $5,000 refundable tax credit that they can take and acquire insurance any place they want to in America.
I'm a new patient with Denver Health, and I haven't been able to get in with a primary care because there's only a limited amount of spots. If I had health insurance, I would just simply call up the provider that would take my health insurance and probably be in within a week. You know, I've been dealing with this for the last 3 to 4 months, and really I think I've been telling myself I'm just tired because it's, you know, been a hard winter, or, you know, it's just allergies. But if I had health insurance, I would have just gone to the doctor already.
In our urgent care clinic, where we might see 100 or, like last Wednesday, 118 patients during a day, you know, perhaps 40 or more of those patients are uninsured, and on certain days that's even higher. Ms. Salazar.
Yeah.
I'm Dr. Long.
How are you?
I'm okay. How are you?
Pretty good.
Well, we need to talk about your ankle, apparently.
For the past couple of days, I've been trying to get seen, and it's been a big deal, but I'm here now, so I need to know if it's broken, sprained, I mean, I don't know.
Exactly. We're going to figure it out. We're going to do our best. There are a lot of patients in Denver County and the surrounding area who know that they can come to Denver Health for care, that they will be treated for urgent illnesses. There's a decent chance that this is just a sprain, like you were saying, but, you know, I think it'd probably be the best thing to do to just check some x-rays. The number one problem we have is the high cost of medical care. I need to know, you know, is it really worth an extra $200 or more on the bill that they're going to receive to get blood work or an x-ray, and it's a challenge. And the cost and also the social stigma of having to come in and say, I can't pay for this, I don't have insurance, but I need care. That's a barrier for people.
It's kind of one of those things where you decide, is it worth the energy at the moment, or should I try to tough it out? I've been blessed in that nothing too major has happened to me, but it's still draining physically and just hard.
We see people all the time who have delayed care for months, weeks, perhaps even years for certain complaints because they just were too afraid to come in. Maybe they don't have the financial resources, maybe they're undocumented. There are a lot of barriers that exist, and so we see a lot of those people who are, for the most part, healthy, but have some sort of event, medical event, where they need to seek health care, and then they're caught into this catch-22 where they don't have the coverage to pay for this high-cost health care, but they need to get it somewhere.
Going to the doctor is not the first option for me, ever. It doesn't feel like it's back, it's just my tonsils, and just not feeling like I'm a priority. And when you're sick, you're in need, and you want somebody to take care of you. And the last thing you should feel is that nobody wants to take care of you, or that you're kind of tossed to the side. It started Friday, but I kind of just was like, oh, maybe it's just allergies. And then by Sunday, I was like, okay, I'm fed up with this, and it was getting really painful. And so, but it's still here.
Yep.
People treat you differently when you have health insurance.
There is no destiny that we cannot fulfill. Our new American majority can end the outrage of unaffordable, unavailable health care in our time. We can bring doctors and patients, workers and businesses, Democrats and Republicans together, and we can tell the drug and insurance industry that while they get a seat at the table, they don't get to buy every chair. Not this time. Not now.
Can I say
As medical care has gotten more expensive, as insurance has gotten more expensive, what's happened is every employer now has to look at that and say, can I afford to continue to do this? And the answer for many of them is no. So the number of employers offering health insurance to their employee drops every single year and has for the last 25 years.
I've had patients decline things due to cost against my objections because I try and provide the same care to every patient, but they have the autonomy to say, I don't want this done or I don't want that done. I just try and let them know what I think is medically relevant and medically important for them. And I do have to factor in all these issues, and it does impact the care because it slows me down. I have to think about the context of where they're coming from, what they're able to afford, what they will be billed for.
Okay, you can sit however you're comfortable.
All right, I'm gonna torch you for just a sec. Say ah.
Okay. I believe that if I had health insurance, this would not be an issue, and I would already know what's wrong with my tonsils.
In times like this, like sort of an allergy flare is kind of what I call it. The decongestants.
Prolonging having to see the doctor and know what's going on isn't a good deal, because a lot of times with anything, it just gets worse. It doesn't just stay in its little box, you know. The problem gets worse. I vote on candidates based on what I see. Right now, I'm not really sure about who I would vote for, just because I'm not necessarily too impressed in one or the other. And so no matter who wins, they're going to have to deal with the issue. And I don't think you can stop that.
There's a groundswell on the part of people like me and my colleagues to try and have real change and to really make an impact on what we're doing, and to try and have an overhaul of this fragmented and mostly broken system.
Am I concerned about my throat? Yes, I'm very concerned about my throat. There's a lot of fear.